Hi, I'm Reid, editor of the Edison Report, and we are here at Mount Sinai's Light and Health Research Center Partners Day. And I'm joined by Bryan Steverson of GSA. Bryan, welcome.
Thank you very much for having me.
Well, thank you for sitting down with me. And tell our audience a little bit, why is GSA interested in lighting?
Well, so GSA is one of the largest landlords in the country. We provide space for the federal government, for public agencies that are non-military. We're all across the country, including territories. We partner with a lot of agencies. We house over 1 million people and 380 million square feet of real estate across the country. We are extremely interested in lighting because of the impact that we have on the market, but also the people that visit and work in our buildings. We believe that our occupants are the occupants of our buildings are the biggest asset that we have. 90% of the building is actually the occupants' cost.
Sure.
The other 10%, of course, is the buildings. And so for us, it's really important to ensure that our workspaces are at the optimal level for people to come to work every day. We've done studies with the Lighting and Health Research Center showing that people that get the most amount of light, the best kind of circadian effective light during the day, they sleep better at night, they're more alert during the day, they're happier, and they perform better. So for us, it's kind of a no-brainer.
Well, I heard you say in our open discussion here, it's not so much about healthy buildings, it's about healthy people. And I thought that was a really good point.
The reason we exist, GSA, real estate's one part. We also do a lot of other things, but the whole point of GSA is to be in the background and really to ensure that the other agencies that are working in our buildings are effective in doing their jobs and meeting their mission requirements. And so in order for us to do that, we need to make sure that we're providing the people in the buildings the best kind of workspace that they can have, and that includes great lighting.
Well, can we speak specifics? When you say great lighting in these buildings, specifically what are you talking about?
So my interest, of course, is lighting and health, and I'm most focused on ensuring that people have optimal circadian effective lighting. So great levels of circadian stimulus in the morning, and then throughout the day, levels to ensure that people's circadian rhythms are entrained, synchronized to the day, so that you're more alert during the day and you sleep better at night.
All right, and how do you actually do that? Do you have these on timers? Is there a person in the building that adjusts the light? How does it work?
So I think, in our experience, the most important thing is to ensure that for a building that's being constructed, that we get this information into the design of the building, right?
Okay.
We don't do a lot of new construction these days. Most of our buildings are older, 50 years old plus.
Wow.
So it's really to ensure that people that are in buildings that aren't being constructed have the ability to move around. Right? Okay. So if you've got windows, if you have the ability to sit in an open space with lighting, we call those lumen showers, but basically an area where you just get lots of natural daylight coming in. Right. If you have the ability to sit there in the morning for a couple of hours to take care of emails or have conversations, meet with colleagues, that's the best way to really do it. So it's really just providing information to our to the building occupants, to visitors that come to our buildings. How can you ensure that you're getting enough kind of light, the right kind of light, the right time of day?
I think you said you've got about a million people. Do you have any idea what percentage of those people are in buildings that have good circadian lighting?
I don't have an exact number. I would say it's probably not enough. I think, before COVID, of course, we were all going into the buildings. Since the pandemic, a lot of us have been working from home. But more and more people are coming back into the office. I think there really is sort of an opportunity there to re-educate, since we've all kind of lost our way in how we operate in buildings and how we do certain things. This is a great opportunity to really sort of illuminate people as coming back into buildings. Sure. What are things you can do? So I think it's a fairly low percentage, unfortunately. Again, from our agency's portfolio of buildings, most of our buildings are 30, 40, 50 years old. Right. And a lot of those buildings were actually built for an entire purpose altogether, whether it's warehouses, old depots, for instance, and we've retrofitted those into office buildings. As I mentioned, we just don't have a lot of newer buildings, but we just have a tremendous opportunity to really right the ship in terms of lighting.
We're here at the Light and Health Research Center in New York, and this was an old train station. So here we are. They've done a very nice job of this. Now, as the people come back to work for GSA, Are you doing any UVC to help clean the buildings?
We've had the use of UVC in our coils. It's in our standards, in our specifications. We've been doing a lot of that. We've been doing more of that, of course, making sure our buildings are filtered and filtrated and cleaned. That's been very important. We've done a lot of work trying to figure out humidity levels, relative humidity levels, temperature, of course, and ventilation, just trying to make sure that we are meeting performance specifications, of course, but going above and beyond, especially with all the research coming out with COVID and disease transmission, things like that.
Are you able to measure any kind of productivity increases or any kind of health benefits with the employees that they are healthier? Do you have any data on that?
We have data that shows if you receive light in the morning, enough light to entrain your circadian rhythm, you're sleeping about 45 minutes more each night.
Okay, now that's a lot.
That's a tremendous selling point. I think we can all relate for needing more sleep. And so we have that data, we've shown that data, we've seen that data in different geographical locations around the world, not just in North America, but also overseas in Iceland and in Latvia.
Well, in Reykjavik, you did some work, and
We
I
did
think
some
in
work,
Sweden.
in Latvia.
Can you tell our audience a little bit about?
Sure. We partnered with the U.S. State Department and 2 embassies. We were actually approached by the State Department for their embassy in Iceland in particular, because people there, foreign service officers over there, were complaining about lack of daylight and seasonal affective disorder,
Right,
and impacts, from that. And they were asking us, what can we do? Embassies, we don't manage ourselves. State Department actually does that, but they heard about our other research within North America. And so we went over there, and we went over there twice, both in the summer and the winter, just to take tests of human subjects in those spaces to measure the amount of light they were getting. And then we provided supplemental electrical lighting solutions within the workspaces that lights were actually coming up into the participants' eyes, and measured and saw that with this supplemental lighting that they incorporate into their space, they felt better, they slept better at night, and they tended to be happier while they were in the office building as well. But this didn't just happen in Iceland. It also was very similar to the results that happened in Latvia. So having both of those data points in areas of the world where you're only getting 4 to 6 hours of daylight a day,
Wow.
in the wintertime, showed us that, this really, and to also say that those results mimicked very closely the results that we found in Portland, Oregon, and Grand Junction, Colorado, and in Washington, D.C. So for us, that was just a big, validation that lighting really does have a tremendous impact on people while they're at work, because at the end of the day, we spend 90% of our time indoors, and most of that time during the day is in office buildings.
Well, as a taxpayer, it is sure refreshing to see the GSA doing this. So, thank you.
Thank you.